In many cases in veterinary medicine, we have finally kind of crossed the Rubicon, if you will, to the point where veterinarians are willing to say, okay, there is application for medical cannabis. Now the discussion is medical cannabis an appropriate first line therapy, or is it something that should only be used when everything else has failed? My name is Gary Richter. I'm a veterinarian in Oakland, California, and I practice integrative medicine, meaning that I offer both Western and alternative forms of medicine for my patients. What that means is that in addition to standard Western medicine, so pharmaceuticals, surgery, dentistry, that sort of thing, we also provide acupuncture, chiropractic, physical therapy, herbal therapy, nutritional counseling, so things that you wouldn't normally find in a more conventional doctor's office. The term cannabis, I think it bears some defining, because there is a lot of misconception as to what that means. There's a lot of people out there that are using the term CBD to effectively define cannabis as a whole. So to be clear, cannabis defines the plant, Cannabis sativa, and that plant can produce many different compounds, including CBD, including THC, including quite a number of other compounds called cannabinoids or terpenes, flavonoids. There's a lot of potentially medicinally beneficial compounds. Now, a lot of people are very familiar with CBD because CBD is so readily available. The CBD that people are buying sort of over the counter, so be it from pet stores or online, that sort of thing, that is CBD that comes from what is called hemp. So hemp is cannabis. Legally speaking, hemp is a cannabis plant that produces less than 0.3% THC. So that is quite honestly a completely arbitrary definition by the government, but that's what it is. So when you're buying something online that says CBD, then that's coming from hemp.
My name is Heidi Hill, and I'm the owner of Holistic Hound. Holistic Hound is a pet store that I started in 2003 here in Berkeley, California. About 4 years ago, we started our own line of CBD supplements for dogs and cats as well. And we sell those both in the store and nationwide through independent pet retailers around the country. We don't have a lot of misconceptions in our area, but because we are distributed throughout the country, there still is occasionally a perception that these products might get their animals high, and they're a little concerned about that, or a lot concerned about it. They don't really understand the power of it. All of our products are organically grown from Colorado, and they're THC free. So we just have to continue to educate people to help them understand that these products are not, they're not psychoactive. They are calming and help support the immune system, and they have a lot of different benefits, but getting high is not one of them.
Now, to be clear, the CBD that's in hemp versus the CBD that's in other types of cannabis, it's the same CBD. The molecule is what it is. The difference between the two is what else is in there. So other types of cannabis quite obviously have things like THC in them, which is a psychoactive compound. So when you're looking at cannabis products, medical cannabis products that have THC and other ingredients in them, it's very important to get medical guidance on how to use these, because just like in a person, THC can have medical benefit in animals, but it has to be dosed appropriately to avoid any side effects, since animals are just as susceptible, if not in some cases even more susceptible, to the potential problematic effects of a THC overdose as would be a person. And honestly, I think that's probably at this point it's probably a matter of professional opinion, because specific clinical research into the use of cannabis in the veterinary medical field is very much in its early stages. There's a few studies out, but really not much. I have seen animals that I think did as well or better on cannabis than they would have done on more conventional therapy. So in my opinion, yes, it's sometimes as good, if not better, than Western therapy, but certainly not always. Yeah, there's a number of common misconceptions, and when I speak to groups of pet owners, one of the questions that I frequently get after an hour-long discussion of how to use medical cannabis in animals is, so you're telling me I should blow smoke in my dog's face? And the answer is categorically no. The cannabis preparations that are used in animals are almost exclusively things that are given orally. They can be a liquid, like an oil. They can sometimes be in treats. But it's almost always ingested. There are some applications for topical, but under no circumstances is blowing smoke anywhere near a pet ever going to be okay, no matter what the smoke is. So that's just a non-starter per se. And then really the other misconceptions are there are people out there who believe and would say that THC is blanketly toxic to animals. Also not true. There is absolutely such a thing as THC toxicity in animals, and just like with any other medication, any other pharmaceutical, success has everything to do with appropriate dosing. So there's plenty of drugs in the veterinary and human pharmacy that, if used inappropriately, can cause harm. That it's no different with cannabis, particularly preparations that have THC in them, but if they're dosed appropriately, they can do an awful lot of good. So this is where appropriate medical guidance really comes in handy. And then I would say kind of the last thing from a misconception standpoint is a lot of people feel like that they can just sort this out themselves. They can get information online. They can talk to a bud tender at a dispensary. They can talk to somebody that they know, etc. And there are so many different potential preparations of cannabis and so many different applications, and so many of these products that are available can potentially be harmful. It would be a mistake for somebody to try and do this on their own without some form of medical guidance. If somebody wants to use cannabis in their pets, I mean, the first thing I would say is if there's any possible way to have a conversation with a veterinarian who's willing to have that conversation, that's your best bet. I understand that is not always possible, particularly depending on where people live. There are some other resources available. For example, my book, The Ultimate Pet Health Guide, has an entire chapter on medical cannabis. It has both medical indications as well as dosing information in there. So that's something that people can look at. There are some courses that are available online for pet owners as well. So there are things to do out there. And I guess the last thing I would say on that topic is if you just don't have access to anything, only use a hemp-based CBD product. The reality is that it would be very, very unlikely to cause any kind of major side effect with a hemp-based CBD product. But as soon as you kind of cross that line into something that has THC in it, you have to be very, very careful.
The reason why I got into this business was to help animals. I mean, our mission statement is to help improve the health, wellness, and quality of life of animals. And that's the mission statement for the store, and was from the get-go, and it is for this business as well. There are a lot of people getting into this business for different reasons, and while there's nothing wrong with making money, I do think that it's important that it come from the right place. Because really what we're trying to do is help animals here. I mean, there has never been anything like this that I've been aware of, this kind of a game changer type of product in the time that I've been in the pet business. And I'm a homeopath too, so I was in the health business even before I got into the animal business. And this is a real game changer. I mean, it's here to stay, and it's helping millions of people and dogs. It helps provide balance or homeostasis, and that's big. So that's our mission, is to help animals. That's always going to be why we're in this.
I always learn from my patients. I've been a veterinarian for over 20 years, and I learn something all the time from my patients. So So certainly there's a lot to be gained from seeing how these animals respond, what works, what doesn't work. And honestly, I mean, the other place that you learn is you follow the research. Like I say, there's no shortage of research. I mean, a lot of it right now is going on in human medicine, but honestly, there's not that big of a difference. I mean, the human research is still applicable to where we're going in veterinary medicine. So I mean, it's a question of both what's working in the real world, but equally as importantly is the research that's going to explain to us why it's working.